Good afternoon, Dr. Raynor. Could you please tell us a little bit about your practice?
Yes, I'm Max Raynor. I'm an optometrist in Central North Carolina. And I have 3 offices here, and I've had a relationship with Carolina Ophthalmics since about 2002, where I got my first non-mid retinal camera and started with iMACAM. Since then, I've used all the iMACAM products, and I feel like I'm very proficient at all the iMACAM products.
Very good. Could you tell us about your patient's experience when they're called from the waiting room to the exam?
All patients are accompanied by a technician for autorefraction, the optomap, corneal topography, screen and visual fields, and other things that we do for every patient in our practice. The technician captures high quality digital images from each instrument, and all the exam instruments are connected to the office computer network, so their images are automatically routed by patient ID to the patient's record in the image management system. This image capture and integration system is called iPAPERLESS. My office uses the iMACAM image management system for storage and review of all images acquired by the iPAPERLESS system. After reviewing the patient, if needed, I can get data from the OCT, whether it be the nerve head, retina, or anterior seg, specular microscopy, the electrodiagnostic testing, such as VEP or the ERG, and other equipment. The possibilities are limitless. When a patient finally sees me in the exam room, I have all the current day's information on the computer monitor, as well as access to the patient's prior visits. I can immediately begin the exam with all the information I need. When a patient finally sees me in the exam room, I have all the current day's information on the computer monitor, as well as access to any prior visits data. I can immediately begin the exam with all the information I need. I also have a computer monitor mounted so I can show and discuss any of the images and my findings with the patient. They really like this, and it's my opportunity to explain what I see and educate the patient, which they appreciate very much.
Could you describe the iPAPERLESS system in a little more detail for us?
iPAPERLESS converts instrument data into digital images that can be networked to the exam lanes and placed into image storage and electronic medical records. iPAPERLESS has the capacity of integrating many older instruments that do not have their own native network connections. So you may be able to use much of the equipment you currently own in your office, not just that equipment that's 5 years old or newer. At my practice, the images and instrument reports collected by iPAPERLESS are sent to the iMACAM image management software, where images are contained in one place in a logical, easy, and intuitive format. Digital images need to be easily accessible and organized so a doctor can review and assess the information on that day, as well as quickly access prior imaging for comparison. Selected images and reports can then be converted to a simple PDF file that can be dropped into your EMR. Historically, EMRs have been very strong as to the written word, but very weak when it comes to the inclusion of imaging and reports, which is often an equal or even more important component of the patient record. iPAPERLESS is the remedy for this weakness.
Does the iPAPERLESS system really improve your optometry practice?
Every eye care professional today understands the need to see patients more quickly and efficiently, while at the same time not sacrificing any quality. iPAPERLESS and iMACAM allow our doctors to see 40 to 50 patients a day, and they do an extremely thorough job, and it's pretty much stress-free, even with elderly and complicated patients. The data from all my instrumentation is right there in front of me and at my fingertips. Dr. Time becomes more about what it should be, assimilating the data and formulating the plan. Even though most instrumentation has its own native software that can manipulate the images to give more information if there's a problem, you don't have to take that time on the most of the cases, 90+% of the cases, that things are normal or you get the information you need right there. Patients leave with every aspect of their eye health and vision evaluated thoroughly. They also have a visual understanding of the problems they might have rather than just hearing words that they often don't understand. Finally, and most importantly, comparisons to prior data can be instantly performed, finding even subtle problems that couldn't be discovered in any other way. Finding no changes often is valuable as well. It gives the doctor peace of mind you can't put a dollar figure on. Having complete and easily accessible digital records often is your best response to questions, complaints, and your best defense against malpractice. iPAPERLESS takes over the task of moving data from the pre-testing area to the lane and ultimately the chart, allowing either more time for techs to see more patients or less staff required to see that same number of patients. There is also a tremendous time and cost savings, as reports don't have to be printed and then stored somewhere else.
Right.
Some doctors go through the process of printing out reports from visual fields, the OCT, or other technology, and then they scan them back into the record. iPaperless eliminates this step. These time and material savings alone can cover most, if not every bit of the cost of the iPaperless system. Another huge benefit is the ability to access information away from my office. My EMR is cloud-based, so not only can I access on my iPad the written portion of the exam, but also the images and reports as well. I was recently at a conference in Boston and was contacted by a patient one Saturday morning. I was able to answer her questions and solve her problems, seeing all her information right there in front of me. So the patient retention advantage that results from being able to access that data from anywhere is invaluable. Finally, iPaperless allows you to send images and secure messages to other doctors. For instance, I can easily send an image to a corneal specialist or a retinal specialist that I'm co-managing a patient with. Or I can send retinal images to the family doctor for a diabetic eye exam report that really makes a big impact.
Was iPaperless difficult to set up in your practice?
Oh no. All you need is good network equipment with computers in your exam lanes and your own IT guy to assist with the setup and maintenance. An internet connection should be available for remote support and maintenance as needed.
And Dr. Raynor, who sells and supports the iPaperless and iMACAM systems?
Carolina Ophthalmics of North Carolina created the concept of iPaperless and iMACAM software and is responsible for product development. The iMACAM image management system has been around for many years and is often included with retinal camera systems. iPaperless is a newer technology solution that is a response to the need to capture and integrate multiple instruments into the eye care practice. JADTech Corporation of California writes and maintains the iPaperless software and provides hardware if required. JADTech is responsible for installation, training, and the ongoing support of the iPaperless system. Most problems that arise can be handled remotely, so there's no need for expensive service calls.
Dr. Raynor, this has been quite informative. Do you have any final thoughts?
Well, I recently spent a couple hours showing my system to one of my colleagues here in North Carolina. After we finished, the first comment he made is, "I have seen the future." That's not really true because as the technology has arrived today and it should be a part of everyone's practice, I don't think I could practice without it.
Excellent. It's been very good talking to you.